Good morning. This is the Board of County Commissioners Agenda Setting Work Session. It is Tuesday, September 13th, 2022. It is 9:05 a.m. This is a hybrid meeting. We're in Building 1, Room 280. For public virtual attendance, you may follow along on the Thurston County YouTube channel. I'm Carolina Mejia. I'm the chair of the board. I'm joined by Vice Chair Ty Menser at the end, Commissioner Gary Edwards here in the middle, County Manager Ramiro Chavez, Assistant County Manager Robin Campbell.
And our special guest.
And our special guest today, my daughter Camila, will be joining us. So today's agenda, we'll start off with the Public Health and Social Services Infectious Disease Update. County Manager.
Yeah, Kurt, Dr. A.
Good morning. I'm Kurt Harden, Interim Director for Public Health and Social Services. We're going to be giving you an infectious disease update. It'll be the COVID update that you are more familiar with, and then we'll talk a little bit about monkeypox as well. So for our update, this is all of our information today is as of September 11th, unless otherwise noted. I should also mention that the last update to the Board of County Commissioners was August 2nd on COVID and also monkeypox. Our total case count in Thurston County as reported by the state is 58,413 since the start of the pandemic. And then the total number of deaths, unfortunately, as reported by the state, are 402. Our 14-day case rate is 146.4 as of September 11th. Just to give you perspective, when I last reported to you on August 2nd, it was 395.9, almost 400. So as you can see, our case rate, our 14-day case rate has dropped significantly over the last 4 to 5 weeks. Our hospitalization data, we've had a total hospitalization of 2,820 since February 2020 when COVID started. On our current COVID patient numbers, we have 16 patients that are admitted into the Thurston County hospitals with COVID. And then just to give you perspective, when I reported on August 2nd, we had 30 patients that were in the hospitals as a result of COVID. So you can see those numbers have come down significantly as well. There's one patient on a ventilator for COVID. And our ICU available capacity, we have 8 adult bed capacity. And our acute bed availability is 29 adult beds. Going into our congregate care outbreaks, this information is as of September 7th, but we have a total of 269 congregate care outbreaks since the start of the pandemic. Just to give you some perspective, that number was 258 on August 2nd, and we are currently looking at or investigating 21 congregate care outbreaks that are currently ongoing. For our vaccination rates, we've had a total doses in Thurston County, and this is all as of September 10th, 565,063 doses in Thurston County. The percent of population initiating a primary series is 74.2%. The percent of population completing a primary series is 67.2%. And then the percent of population in the county initiating primary series age 16 and older is 83.7%. And then the percentage of population completing that primary series age 16 and older is 76.1%. And then the percent of population initiating the primary series age 6 months is 74.6%. And the percentage of population that's completed the primary series age 6 months and older is 67.6%. And then the percentage of eligible people receiving boosters age 5 and over is 58.3%. Additional items for vaccination. We have a vaccination clinic Wednesday, tomorrow, September 14th. It runs from 11 to 4. And this is a pediatric clinic for ages 6 months to 5 years at the Yelm Community Center. And that's located at 301 2nd Street Southeast in Yelm. And appointments are highly recommended. On Thursday, we have a vaccination clinic. It's the Bivalent Moderna Booster Clinic for ages 18 and older at the Family and Youth Resource Center. This clinic's located at 200 Sleater Kenny Road Northeast in Olympia. And this is appointment only. We are already at capacity for this clinic, so people have appointments to show up, but we are not going to be able to allow walk-ins because the clinic's already at capacity. On Friday, September 16th from 11 to 4, we have a bivalent Pfizer booster clinic for ages 12 and older at the Tenino Food Bank. This clinic's located at 224 Sussex Avenue East in Tenino. Walk-ins are going to be extremely limited. We haven't reached capacity yet, but the appointments are highly recommended because they're filling up fast. And then on Saturday, September 17th from 10 to 4, there's a pediatric clinic for ages 6 months to 5 years at the Thurston County Public Health and Social Services building. Is located at 412 Lily Road Northeast in Olympia. Again, appointments are highly recommended. And then I would ask everyone to go to the Thurston County website for the clinic schedule beyond this weekend. It's posted there. And then I wanted to talk a little bit about testing. We distributed over 5,300 test kits, and our strike teams have performed over 150 tests just within the last 30 days. And then also test kits are available by Public Health and Social Services by calling 360-867-2610. And with that, I will turn this over to Dr. Abdul-Malik for her piece on the COVID update.
Good morning, commissioners. Our COVID-19 numbers continue to be downtrending, which is encouraging. I did want to update you on two new key developments. The first is the availability of bivalent COVID-19 vaccine boosters. There are two types of bivalent boosters, one made by Pfizer for people age 12 and up, 2 months after they're either completing a primary series or after a booster dose if they received a monovalent booster dose. The other is Moderna, which is available as a booster dose for folks 18 and up, at least 2 months out from from either completion of primary series or any booster doses. This is encouraging because these vaccines, so what bivalent means is that there's information in the vaccine that helps your body fight off two different antigens. So both the original SARS-CoV-2 virus as well as the Omicron variant. So at this point in time, I definitely recommend that people who qualify for the bivalent boosters, do make an appointment and get and receive the vaccine. The other bit of information that I did want to share is updated testing guidance for people who were either exposed to COVID-19 or who have symptoms consistent with COVID-19. So the Washington State Department of Health recently released that more self-testing guidance. And that includes for folks in those two categories, testing every 24 to 48 hours until 5 days have passed, either since the symptoms started, if the symptoms persist, or 5 days post-exposure, if asymptomatic. For other folks who don't have symptoms and are testing out of an abundance of caution, the guidance and don't have a confirmed exposure, the guidance at this time is to follow the directions on the self-testing kit package. Most actually include testing twice over a period of 3 days in order to have the most accurate results. As we move forward, we do continue to provide technical guidance to congregate settings on COVID-19 and are encouraged at the downtrend in the outbreaks that we're investigating and monitoring. So there has been a lot of good news on the COVID-19 front. Our community level as measured by the Centers for Disease Control and Prevention for COVID-19 continues to be low, which is encouraging. I did want to transition a little bit to talk about monkeypox. Last Friday, September 9th, we received our first lab report of a presumptive case of monkeypox in a Thurston County resident. As we do with all of our notifiable conditions, our process is to reach out, provide information to prevent ongoing transmission to all of the to the case and do the appropriate background work. Just a reminder for folks that monkeypox is spread through close contact. So typically close skin to skin contact with lesions, respiratory droplets, as well as contact with objects that may have infectious materials still on them. So to date in Washington State, there have been 506 cases identified, the majority of which have been identified in King County. We continue to offer Cjta. So with monkeypox, people who are at close contact and meet specific criteria, and the CDC does have information regarding the relative risks of different types of contact. But people who are in the high risk category can access vaccine, the Cjta vaccine, through the public health department, as well as their communities of people that in this particular outbreak have experienced some higher risk of contracting monkeypox, and those folks, including folks in the community. So while monkeypox is not a sexually transmitted disease, it can be transmitted through sex as well as other close contact. In this particular outbreak, people that have been identified as being at higher risk are people in the community of men who have sex with men, who've had multiple or anonymous partners in the past 3 months, people who have had methamphetamine use in the past 3 months, folks who may have experienced sexual assault, and others. So for a full list of folks who would be at an increased risk for contracting monkeypox, please reach out to us. The phone number to both get more information as well as schedule vaccination is our 2610 line. So that number is 360-867-2610. And with that, I'm open to any additional questions you may have. Thank you so much, commissioners.
Thank you, Dr. A. Questions, Commissioner Edwards?
Yes, Doctor, the governor put out in his latest comments, I think, that he was going to lift everything at the end of October. Does that mean that we will get back to a normal jail operation at that point?
So the guidance for jails comes from multiple places. So one piece of it is the Secretary of Health's masking order for the correctional and detention facilities, which stipulates masking guidance when community levels are medium or high. The other area that the other place where operations guidance comes is from our federal partners at the CDC, and that guidance, that COVID-19 guidance, is under, based on my understanding, is currently under review, as well as our state partners that work on public health COVID-19 guidance specifically for the correctional and jail setting. So we're awaiting the new and updated guidance, and that'll tell us more. So we anticipate that in the coming weeks.
So you think in a couple of weeks you might hear So we might hear it through your operation then in a couple weeks. Is that?
So in terms of the public health guidance for COVID-19 mitigation, we would be awaiting the guidance from our federal and state partners, and then of course working with our colleagues at the jail to operationalize the latest guidance we anticipate it in the next few weeks, although I will state that sometimes these things can take a little longer than anticipated.
Okay. Look forward to hearing from you when that happens. Thank you.
Commissioner Munzer.
On monkeypox, you talked about risk for contracting, but in terms of the risk for like more severe consequences, are there risk groups for that like there are for COVID? Are they the same? Are they different? How risky is it for what groups?
So in terms of the folks that are at the highest risk of contracting severe disease, it's, folks who are immunocompromised, pregnant people, children, particularly those under the age of 8. There are some other risk factors. So thinking about folks that have exfoliative skin conditions, and then there's also people's clinical experience, where some people might have extensive disease or disease that involves sensitive areas like mucous membranes or eyes or different various places that are at higher risk.
Thank you. And just going back to the bivalent boosters. So this is something that's there right now. We can pick up the phone right now and call our healthcare provider, or is this going out through pharmacies like the federal government did? I mean, what's the easiest way for folks to access what you are recommending there?
Yes, so at this point in time, there are multiple pharmacies throughout the county that are able to provide the bivalent vaccine in addition to public health. If people are having a hard time accessing it, my thought, so they can either call us at the 2610 line or reach out to their provider. But we've seen availability throughout the county in pharmacies and clinics.
And then, just to make sure I got it, the Moderna you said is only folks over 18, but Pfizer is over 12, or is that what you said? Okay, so for me with 2 teenagers at home, I ask for Pfizer when I call up, or that's what I'll be given automatically because my kids are under 18.
So they should be given Pfizer automatically, just because there isn't an FDA approval for Moderna under 18. So
Okay.
I think however, I would just say that some facilities may only have one or the other, or may only have one or the other on a particular day. So I would just check for that.
And this doesn't, it doesn't matter, like if you did Moderna for your primary series, you can now have a Pfizer bivalent booster. That's fine.
Yes, mixing and matching is okay.
Okay, thanks.
And Commissioner, I'd like to just add that many facilities, many pharmacies in the Olympia, Thurston County area have same-day appointments available still. So when you go on their website, you schedule an appointment, you may actually be able to get a same-day appointment at some of the pharmacies and everything. So there is an adequate supply out there of the bivalent vaccine.
Thank you. County Manager, you had your hand up?
I think just to emphasize, Dr. A, for some of us who got the first, series of COVID-19 as well as the 2 boosters early in the year, the new booster that you outlined is a little bit different and perhaps includes a little more effectiveness. They addresses the initial strain of COVID-19 as well as the Omicron, the subvariant that is currently going around the community. Is that correct?
Yes, that's correct.
So I remember the booster was available for people with, immunity deficiencies, for people who were high risk. A second booster was available. So what I'm hearing is that second booster is now available for everyone?
So the second booster that was initially recommended was a monovalent booster that was based on the vaccine targeted towards the initial SARS-CoV-2 virus. This booster includes, this is a different booster, and it includes targets both on the initial virus as well as on the Omicron variant. And it's recommended for everyone regardless of immunization status, as long as they meet the age criteria. And are 2 months out from their last booster dose or primary series.
Okay. In terms of the monkeypox vaccine, how is that going to be through public health, or is that going to be through each individual provider or pharmacy?
So right now, supplies are very limited. And so it is folks in Thurston County needing to access the Cjta vaccine. We do ask that they do come through Thurston County Public Health at this time. As supplies increase, the hope is that there will be additional community partners and access points. But that will depend on, transmission dynamics of the outbreak as well as vaccine availability.
So priority would be given to individuals who pose a higher risk?
So right now, the risk to the general public is low, and that includes, health. That includes most. That includes healthcare providers as well. So there isn't a recommendation for vaccination for people that are. So just to rephrase that, folks who are close contacts and have had high risk contact with somebody who has monkeypox during the cases infectious period should get vaccine, ideally as soon as possible. But people receive vaccine within the first 4 days after exposure, that gives them the best chance of not contracting the disease. There is thought to be benefit to vaccination between 4 and 14 days after exposure, and the thought is that even if a case of monkeypox isn't prevented that way, it reduces disease severity and symptoms. So we've been vaccinating close contacts up to 14 days. Then there are groups of folks that may have that are more likely to come into contact with the monkeypox virus, and so we've been able to offer a vaccine to those folks as well, even if they haven't identified a specific contact. But in general, the risk to the general public is very low, and so key pieces for the public are, just as we've been doing with COVID, stay home when you're feeling sick. Monkeypox is, so the vast majority of people who get monkeypox do exhibit a rash. Some people do have flu-like symptoms 1 to 3 days before they develop a rash. And people are thought to be infectious for monkeypox while they're symptomatic. In general, once if people develop the rash, typically it resolves in 2 to 4 weeks, and people are infectious until the rash has completely healed, the scabs have fallen off, and there's healthy skin. There's healthy skin underneath. So in terms of precautions that I think that I recommend the public take is, if you're feeling sick, if stay home. if you have a rash that's unexplained, you know, and different from rashes that you've seen before, or you have a rash consistent with monkeypox, reach out to your healthcare provider to get evaluated. If you're concerned that you may have monkeypox, either because you've developed a rash or for another reason, isolate at home away from other people and pets, and reach out to your healthcare provider for additional guidance and support.
Thank you, Dr. A. Okay, no additional questions? Okay, moving on to homeless strategies update.
Good morning, Commissioners. Keely Marino with Public Health and Social Services with a quick update for you today. Just a report that we continue to meet with our state partners and our local jurisdictional partners and providers on the right-of-way initiative. Nothing really new to report, just continuing to strategize around a few remaining residents on the Pacific interchanges, and moving onward with eyes on the downtown interchanges in mid-October when potentially some more beds become available. We also reviewed our request for proposals for the housing and essential needs, the rapid rehousing for single adults, and the House Bill 1277 permanent eviction prevention rent assistance programs. We anticipate bringing those funding recommendations to the Regional Housing Council tomorrow. There is a Regional Housing Council meeting at 4 p.m. and if the public would like to attend, if you Google Thurston County Regional Housing Council, there will be a link there to register for that meeting. And other than that, there was a sweep of the camp behind the bottling company off of Phones Road last Tuesday. And all of those residents have been moved off. Again, that's private property within the city limits of City of Olympia. Olympia Police Department and Code Enforcement were on site during that time. Approximately about 30 people have been moved off that site to undisclosed. I'm not sure where they ended up, but they are out in our community somewhere. There was a sweep that was to happen this week at Desmond Drive in Lacey, and they have paused that to come up with a longer term solution. And that news came in late yesterday afternoon that they had decided to pause the sweep of that camp. Ensign Road will be moved this month, and we anticipate the final cleaning of Ensign Road, Olympia's process by mid-October latest. So that is ongoing as they slowly populate the Quint Street Village in downtown Olympia, moving folks from the mitigation site over into that new tiny home village. So that's about it for us in homeless response, and I'm open to any questions you might have.
Thank you, Keely. Questions, Commissioner Edwards?
Oh, man.
Questions, Commissioner Menzer?
Keely, when you said the Desmond sweep in Lacey was paused by who?
So an attorney with the Thurston County Volunteer Legal Services, I believe, came and advised them as to the rights of the individuals living there. And so they decided, Lacey and Department of Enterprise Services decided to pause in order to come up with a solution that was amenable to all.
So this falls within the right of way. This is one of the why is Department of Enterprise Services involved?
So it's on their property. So Department of Enterprise Services that has had a camp off of Desmond Drive for quite some time. So they are just in the process of wanting to see it moved.
Okay, thanks.
Mm-hmm.
I don't have any questions. Thank you,
All right,
Keely.
Thank
Okay.
you so much.
Okay, next is the review of the Board of County Commissioners draft agenda for a meeting of September 13th, 2022. We'll call the meeting to order at 2 p.m. The Pledge of Allegiance to be led by Vice Chair Menzer, approval of the Tuesday, September 13th, 2022 agenda, and approval of the board meeting minutes from August 30th, 2022. We have one presentation today, and it's the Kiwanis Club of Olympia proclamation.
Yeah, thank you, Madam Chair, for your consideration. The board decided last week to have a formal proclamation in celebration of the Kiwanis Club Olympia Day. Jamie, our clerk of the board, reached out to the club to make sure that that proclamation includes the right dates. And I believe she has some follow-up on that. Jamie.
Good morning, Jamie Caldwell, clerk of the board. I did reach back out to the president to send him the proclamation to review and give final sign off on. He said it looked fine. This morning, however, I did receive an email from him letting me know that due to work obligations, he's not able to attend in person, asked for the Zoom link and hopes he can attend via Zoom. He said that he thinks that one of their members, Sam Reed, might be able to attend today, but I don't have confirmation that we actually have someone available to attend and accept it.
Thank you. Okay, questions, comments? Commissioner Edwards?
Well, I guess I could accept it for the club. I'm a member of that club, as are you, so I don't know. I won't arm wrestle you over it because it's always, the chair's prerogative.
You're attending the Centennial Gala though, right? So
Yes.
maybe if we give it to you, maybe you can
Okay.
present it to the membership at that point.
Sure,
If that's okay with you, sir.
that's fine.
Commissioner Menzer, questions?
So the date is correct?
He didn't provide me with any further updates. I can only assume what he sent me. Looks like when I was chatting with Commissioner Edwards' aide this morning, and she'd mentioned that they'd made a request last year. I'm wondering if maybe they just resent the same one that they had sent last year and didn't do any updates to it, but he didn't want any changes made to it.
You guys are, was this club formed less than a year ago?
No.
So I think we need to take out, I think we need to say, started its service Detroit, Michigan in 1915, semicolon. I don't want to say inaccurate information. So I would just remove that next sentence because we know it's inaccurate. We have a member of the club.
Sounds good.
Okay, I'll get that updated for this afternoon.
It's pretty embarrassing when, this has happened. It's not, sometimes it's like, I've seen a proclamation, I've been reading it, and I see like interlineation from other proclamations, and I've had to like try to
Pass it
edit
up.
as I read. So, yeah, I think it's important to just make sure that it's accurate, and if we're unsure, then I think it's prudent to just remove that piece of information that we know is inaccurate.
Well, they're celebrating their 100 years. They're centennial, right? So obviously the 2021 date is wrong.
I don't want to speak for the club management. I don't know what's going on, so I'm gonna let it ride for right now. Might we have an adjustment, maybe by the time we get to the meeting this afternoon even.
Yeah, well,
I think the suggestion that Commissioner Menzer highlights, I think makes
Sure,
sense.
that kind of solves it. Doesn't highlight the issue too much, but it does solve the issue.
okay. With that, there will be an opportunity for the public to address the board and county manager's update.
You might be, I'm going to venture to say that perhaps you may be receiving public testimony related to the item on the Hopkins district this afternoon. I've heard that perhaps the city of Tumwater may be comment and testified, maybe other members of the community, the preserve, maybe also be part of that testimony.
Do we have a proposed date for the public
Yes,
hearing?
sir.
When is that?
It is an item on your agenda.
Today?
Yeah,
Oh,
we'll cover that.
all right.
It's item number 5 on the agenda, 5A. Okay, that we will move on to consent items A through E. We have quite a few. The first one is Central Services, a resolution reclassifying position 25R00603 in the Thurston County Pay and Classification Plan. This is one that we reviewed last week. Go ahead, County Manager.
Thank you, Madam Chair. As you stated, you reviewed this item last week and is also related to the overall briefing the Robin Campbell provided to you in June 8, 2022. They have already taken the steps in alignment to the presentation and the reorganization of central services and all the duties that Robin is responsible for. So this particular items for your consideration is to reclassify a vacant position from a senior office assistant to an administrative assistant one. This particular item, if you approve, has an impact on the budget. It goes from $4,837 per month to $5,333 per month, or $496 increase, or 10.25% increase. At this point, the department is not asking to increase the budget allocation for 2022. However, as Commissioner Edwards stated, this will be part of the best budget on the 2023, which creates an increase over.
Questions? Commissioner Edwards?
No questions.
Commissioner Munson?
No.
Okay. Moving on to item B, Public Works, a resolution increasing the full-time equivalency, there we go, of toll house operator positions in the Thurston County Pay and Classification Pay Plan.
Thank you, Madam Chair. You also, the board also reviewed this request last week, and this includes 12 positions. They're currently classified as the toll house operators. Those positions provide services for like 7 days a week service at the Waste and Recovery Center. And those current positions are considered to be at 0.85 FTEs. And this request is for the board to consider bringing those positions for a full-time FTE. As you heard last week, this is a prudent request. It has been, I believe, in the works, at least from my point of view, for quite some time. It does make sense. Those individuals work beyond the 0.85 FTE time, closer to 40 hours. However, they only receive benefits at 0.85 FTEs. By bringing those positions to a full-time, I think that will be a way to compensate correctly to those employees. And again, there's 12 positions. And the impact of this request as an overall is $40,000 a year. And there is enough funding this year, and this is coming from the tipping fees, the solid waste Public Works Department. Any questions?
Questions, Commissioner Edwards?
No questions.
Commissioner Munson? Okay. Moving on to item C, D, E. It's Board of Health, appointments to the Board of Health.
Thank you, Madam Chair. On Tuesday, September 6, 2022, the Board of Health is currently composed by the 3 Board of County Commissioners as well as representative from the Lacey City Council. I held a special meeting where you conducted interviews to consider appointments for the Board of Health. The result of that process, the Board of Health recommended to the Board of County Commissioners appointments of Dr. Beth Harvey to the Board of Health as Category 1 board member. And this is for a 3-year term with the term expiring September 13, 2025. Also, the recommendation was for the board to consider appointing Ms. Maria Williams to the Board of Health as a Category 2 to the Board of Health for a 3-year term again with the expiration date of September 13, 2025. In the last recommendation for you to consider appointing Ms. Lynn Nielsen to the Board of Health under the Category 3 board member for a 3-year term again, which expires September 13, 2025. These recommendations and the time limits expirations are consistent with the ordinance the Board of County Commissioners passed expanding the Board of Health representation.
Thank you. Questions, Commissioner Edwards?
I do have a question. By any chance, as we move forward on this new Board of Health and we have vacancies develop, are we going to be always listing those as the different categories that were laid out in the new legislation? So it just won't be, there won't be any open seats, so to speak. There's always gonna be designated seats from now on.
Yes, it does, in alignment with the state law. They have to be specific to those categories, and I don't believe that just after the appointment of the vacancy, the mayor could after the appointment. That needs to be filled based on the same regulations and requirements of the state law.
I just wonder, I'm not arguing it, I'm just wondering, for efficiency for some years down the road, as people move on, if we would, are we gonna make sure that the application process lays that out for, because I would like to encourage other folks that have an interest to go ahead and apply, so we're not backed up when the time comes. So we would have a ready list of, in the different categories, maybe we have one or two people that have expressed an interest by filing. So that's my only concern. We
No,
make sure.
like any other vacancies, the public can submit any applications and then.
And that's gonna be showing though, when they go to the Board of Health
And, yeah, they have to be.
webpage, it's gonna have that to review. And
Yeah.
here's the group I'm interested in
Yeah, in the
representing.
application process, that they have to highlight based on their experience and as to what category they suit themselves best.
Okay, thank you.
Commissioner Menzer, go ahead.
Okay, so we don't have a Board of Health meeting today, but is the intent that we would have a regularly scheduled Board of Health meeting on October 11th?
Yes, sir.
Okay, and before we have that meeting, I want a legal answer to the question of, right now, the Board of Health, after we appoint these folks today, we will have 4 electeds and 3 non-electeds, which is in violation of statute unless we're allowed to count a tribal seat. And there's not even clarity about whether it's 1 or 3 tribal seats, but that seat will have to count, even if unfilled, for us not to be violative of the non-elected versus elected ratio. So I have not heard a definitive answer from Jane or whoever gives us that answer, and I want to make sure that I feel comfortable with that before I'm willing to preside over a Board of Health meeting on October 11th that might be violative of state law. So
Yeah,
just
we'll follow up
fair
on that.
warning.
We'll follow up on that, sir.
Okay, thanks.
Jamie?
May I also interject as well? I have reached out to the gals that you guys are planning on appointing this afternoon to ask for their availability as well, to get that one scheduled. I wasn't sure if we were going to move forward with that one on October 11th as well. And just because there's so many schedules to coordinate between the board here, these 3 external gals, and then Councilmember Vasquez, I wanted to make sure that we had some dates that would work for everyone as well. So, I mean, if there is an issue, we may be able to bump that down to a more mutually agreed upon date as well.
I would imagine we would be taking that issue up at the first meeting and, you know, when the schedules for the future would be.
Well,
But
that will be one of the first things the Board of Health needs to define. It will be how and when you're gonna be holding the meetings, how frequent that will be. And so all that needs to be part of the first meeting. And Kurt and I will develop a draft agenda just to make sure that we walk through some of the initial steps of that.
Can I ask about the coordination for the first meeting? Because I think that's what Jamie's talking about, that first meeting coordination, because we usually hold these meetings, you know, right after our Board of County Commissioner meetings, but before it was just the 3 of us and, you know, our schedule depended on when we ended that, but with people having to work and, you know, having to be here, I mean, is that something where I think we're gonna have to accommodate, just to be able to accommodate those, you know, those 3 other recipients or 4 now?
It was my understanding as well from legal's explanation that by rescinding that, we didn't actually have a standard Board of Health meeting date anymore, which is why they're all noticed as special meetings until the Board of Health makes that decision.
So you really have the latitude to move that meeting to any day and time that you think is appropriate. That you need to have that discussion then the Board of Health. This is the Board of County Commissioners. We have not listed this meeting as a special meeting of the Board of Health.
okay. Well, as the Board of County, so as a first thing, I've asked that we not, unless we're gonna have a special meeting and move that time, which I don't think I'm in favor of, but it's a different discussion. I would ask that we not set any public hearings for that day on the 11th, if we can.
No, in fact, the public hearing for the Hopkins district, I specifically moved that a
Yeah,
week later.
appreciate that.
Yep.
And, okay, well, we can't really discuss the.
Yeah, I appreciate the feedback, but you are acting as a county commissioners, not as a Board of Health members at this point.
But it was okay for somebody or other to set the meeting from the 11th, given what Jamie said about the ordinance has been rescinded and we don't actually have.
Well,
a set time.
that was the standing schedule. We have followed that schedule. And maybe when we review the Board of Health agenda with the chair, that may be an opportunity as to how we can probably remove that. And I think that's perhaps the priority of the chair as well.
Okay.
So as Jamie is correct, every single meeting for this point forward is a special meeting for the Board of Health until Title 1 of the Thurston County Code is amendment to specifically outline when and the timing in which the new Board of Health will meet. And that's one of the first steps the Board of Health needs to take.
Okay. Anything else on those three items?
No, ma'am.
Okay, moving on to department items. First item, 4A, from the Auditor's Office, approval of the voucher list.
Thank you, Madam Chair. This item is in your as a department item. And is for board to consider approving the voucher list for the week of August 8th, 2022 with a combined amount of $1,994,792.41. It is on page 43. There is expenditures related to the atrium for $71.70 as well as $1,715.95. Also, there is payments to the atrium on page 47 for $146.85. Overall, this voucher list has total payments related to the atrium of $1,934.50.
Thank you.
Questions?
No, ma'am.
Once we move, Commissioner, will we be able to put this back on consent, or is this going to be ongoing into perpetuity?
I'm hoping we're reaching a settlement.
All right.
Okay, moving on to item 5A from the Commissioner's Office, at a public hearing, suspension of operations of the Hoffman Drainage District.
Yeah, thank you. If with your indulgence, I will take some time to walk you through a little bit of history, and this is mainly to the benefit of the public as to why this item is coming to your attention. So let me begin back in about mid-year 2025, early in 2020, just about March. We received the department and the county received the questions related to the storm water utility fund. And those questions were from Commissioner representing the Hopkins Drainage District number 2. And those questions related to the utility funds as well as the authority the county has over the drainage district. In March 4, 2020, we addressed those questions related to the authority the county has and the authority in the county that not having the authority to provide any type of funding from the stormwater fee utility. That was clear on March 4, 2020. And I'm going to walk you through a couple tracks related to this matter, so bear with me. Hopefully that makes sense to you. And mainly the public.
And the public.
Mainly, you're tracking on the issue. This is for the public's benefit. So fast forward to January of 2022. The Hopkins District introduced a piece of legislation which they require not just Thurston County, but all the counties to pay back 7 years of worth of stormwater fees that can be deposited on their as part of their funds. That piece of legislation didn't have a hearing, didn't go anywhere. And that also created a great deal of concern by the Washington State Association of Counties, because it was not only applicable to all the drainage districts in the state, and it may have a detrimental effect to the funding of the stormwater utilities across the state and other counties. So that was where we stopped a piece of legislation, I believe. And as you may recall, the Board of County Commissioners opposed that bill when we were reviewing that particular bill.
As did the Association of Counties.
As well as the WASA, the Washington State Association of Counties. Moving forward to this year on that track, I believe a couple of district commissions met with the board of individual board members of the commission, in which they requested specifically to reimburse $259,217.73 from the stormwater fee to their drainage district fund, which is 6350. The board had a conversation and directed me to send a letter, which I sent on July 7, 2020, to Commissioner Matt Jackman, stating the county does not have legal responsibility or legal ability to fulfill their request for transferring the stormwater funds. The result of that was the Hopkins Drainage District sent a public records request, and we're in the process of responding to that request. That's track number 1.
Can I add something to that?
Yeah, please.
The Board of County Commissioners letter that you just referenced was only directed to be sent after at least I, and probably my seatmates as well, asked staff to follow up on at least 4 different questions raised by the commissioners in the district, claims that they made that sounded a little not quite right to me, but I did my due diligence and I had staff follow up and answer those questions, all of which didn't seem to be consistent with the ditch district's characterization. And so in light of that information, we asked you, or we authorized that second letter.
Yeah, thank you for that clarification, Commissioner.
I just wanted to make sure, because I did take very seriously the information that I got from this group and checked out all of the different claims.
Some of the questions in the claims also were addressed in the March 4, 2020 letter, and we just emphasized that when we responded in July of this year. So that's track number 1. Track number 2 related to the Hopkins Drainage District. As you may recall, early in the year, we had a significant rainfall in early January. And most of the stormwater facilities across the county, perhaps across Western Washington, were overwhelmed by the amount of rain. So there's just a lot of flooding that occurred on that. And in fact, the Board of County Commissioners just approved an agreement with FEMA in order for us to get reimbursed in response to the flooding, because that was unprecedented the amount of rain that we received during that time, and the President of the United States has declared an emergency in order for us to get reimbursed for that. So that's the track number 1. So early in the year, the Hopkins District Chair provided testimony to the City of Tumwater Council, and I believe it was maybe in February, requesting $75,000 from their stormwater fees to be deposited on their account. And the argument was that perhaps the overwhelming of the stormwater event that all of us received was not necessarily related to the amount of rain the regions received, but perhaps it was related to the preserve development. The preserve development is located in the incorporated boundaries of the City of Tumwater. That is just about 545 homes the preserve has. And the argument at that time was because of the stormwater design of that preserve, did not adequately meet the requirements, and as a result of that, the overflow of that particular stormwater facilities caused the drainage district to incur flooding. So the city of Tumwater responded later in the year, denying the request of the $75,000. In the same terms as the county declined their request for us to transfer $259,000. So as the year progressed, back in June 2022, the drainage district sent a notice of a public hearing to all the members, all the residents of the preserve. That's just about 544 homes. And that notice of a public hearing included that as under RCW 85-32-210-32, the ditch district has the ability to impose fees and charges to properties outside of the boundaries of the Hopkins district, the drainage district in this case. That public notice that was sent to the property owners of June 2nd, 2022 is scheduled a public hearing for July 9th, 2022. The day before July 9th scheduled meeting, they canceled and rescheduled the public hearing, and those public hearings were held in late July 2022, and had a continuance of a couple of public hearings, the drainage district, because they received significant objections from the residents of the preserve as to why they go about in imposing fees outside of this or their district. And the arguments were for the most part is taxation without representation. And a taxation without representation from their perspective is they're going to be taxed and impose a fee, and they don't have the ability to vote for the elections of the ditch district commissioners. That is the perspective of the objections of the property owners. So leading to those public hearings, on August 17, 2022, you receive a letter from Mr. Heather Bridges, and she is from Phyllis Burgess attorney firm, which now is representing the interests of the preserve. And again, those are 545 homes. In that letter, I'm not going to read you in detail what that letter is, but ask you for the Board of County Commissioners to take two actions. One is for you to consider sending to the Boundary Review Board the expansion of the drainage district. You received some legal feedback that perhaps at this point the Board of County Commission does not have any legal authority to exercise the request from Ms. Burgess related to refer this matter to the Boundary Review Board. The second request Ms. Burgess' letter is for the Board of County Commissioners to consider the suspension of the operations of the Hopkins Drainage District in relation to RCW 85-38220. I believe the board is well aware of this RCW, but let me read you in detail for the members of the public to understand. This particular piece of statute in RCW 35-38220 states that any special district may have its operation suspended as provided in this section. The process of suspension of a special district's operations may be initiated by, number one, the adoption of a resolution proposing such action by the governing body of the special use district. That will be the district will have to pass a resolution. Number two, the filing of a petition proposing such action with the county legislative authority of the county in which all of the largest portions of the special use districts located which petition is signed by voters of the special use district who own at least 10% of the acreage outlined in the special use district. In this particular piece of the statute, you went through when you were considering the Black Lake Special Use District operation zone. In the number 3 part of this piece of legislation, this states as follows. Number 3, the adoption of a resolution proposing such action, suspension of the operations by the county legislative authority of the county in which all of the largest portions of the special districts located. A public hearing of the proposed action shall be held by the county legislative authority at which it shall inquire into whether such action is in the public interest. Notice of the public hearing shall be published in the newspaper, the general circulation in the special district, posted in at least 4 locations in the special district to attract the attention of the public, and mail the members of the governing body, in this case the special district, of the potential action of holding the public hearing. After the public hearing, the county legislative authority may adopt a resolution suspending the operations of the special district if it finds such suspensions be in the public interest. And that signed resolution shall be provided to the county treasurer to stop receiving those funds from the special district. The result of this is the county will take responsibility for the operations and maintenance of the special use district. Also, the county legislative authority has the authority to reinstate the operations of the special use district when also the legislative authority holds a public hearing, and also the legislative authority determines its best public interest. So this action before you is for you to consider holding a public hearing, and this is the result of an executive session and the motion that was placed by the board, and unanimously the board approved to ask me to bring an item for you to consider in a public hearing for the suspension of the public of this drainage, Hopkins Drainage District. And the third parallel track that I'd like to highlight before you and also to members of the public. In Mrs. Burgess' letter outlines in the last 10 years, the Hopkins Drainage District has failed, and that's her words, to maintain the drainage itself, the ditch itself. So maybe 4 weeks ago, the county was aware that the Hopkins Drainage District has submitted a hydraulic permit to the state, asking them to give permission to conduct activities to clear the ditch as part of their activities. We made aware of that particular permit, and within the context of the initial activities they wanted to implement was to use dynamite to eliminate an obstruction in that ditch district. That created a concern, obviously, because the activities in which the drainage district was planning to do is included on the Habitat Conservation Plan, and this is a protected environment for the Oregon spotted frog. As the board is aware, the U.S. Fish and Wildlife has approved our Habitat Conservation Plan and also has given us the incidental take permit. And the incidental take permit is a way to move forward, as you heard, on developing our properties, but also holds a responsibility to the county in making sure that any activities they may harm the protected environment for the protected species under ESA is our responsibility. The result of that, the CPED and the director who worked with the director of CPED to send a letter to the state asking them to hold the HPA, the hydraulic permit, in order to determine what impacts or what mitigation efforts those activities the Hopkins Drainage District is planning to do in this protected habitat. All that combined, I believe, gives the board the ability to hold a public hearing to receive public testimony before you consider approving a resolution suspending the operations of the Hopkins Drainage District. I am working on that resolution, and that resolution will be posted as soon as we announce this on the public hearing, so this will be ready hopefully at the end of this week. Any questions? I hope I was clear.
Questions, comments, Commissioner Edwards?
I guess I would just point out that to prevent this from becoming an explosive situation, I think it's always better that we get more information to make better decisions. And for that reason, I'm in favor of having this public hearing.
Commissioner Menzer?
Just, I mean, the HCP, Habitat Conservation Plan, gives special responsibilities to the county, but even if there was no HCP whatsoever, it would be illegal to use dynamite in an endangered species habitat, right?
Yeah.
I mean, it might
because
not fall on the
even
county's
if
back,
not-
but
if
it's
not
an
under
illegal
the-
activity.
Yeah, is in the critical area ordinance is what we have, also a responsibility. And because under the critical area ordinance is we have already put a stop work order. We are requesting the drainage district to submit an application to determine what are the activities in order for us to find the mitigating measures. So it's two elements of this, and you're correct. Even though the higher call is the incidental take permit, and the responsibility comes with it to the county, but also under the county's critical area ordinance is where we have the ability also and responsibility to make sure that any activities don't harm any protected species.
Well, my point, I mean, that's all true, but my point is that this isn't potentially just about protecting the county, because even if there was no HCP and we didn't have a critical areas ordinance, it would be, we're supposed to be considering the public interest, and this would be illegal activity under the Endangered Species Act. It would be, it wouldn't be us necessarily enforcing it or whatever, but it's still something that we can consider in the context of what the public interest might be in our action.
And you're absolutely right. To my knowledge, nothing trumps the Endangered Species Act.
And that's what the whole HCP idea is about, is making sure we're protecting our citizens against this type of inadvertent criminal activity, but it's essentially criminal activity to do an unpermitted take of a listed species.
Thank you. Okay, and that one will be set for October 18th, 2022 at 3:30 p.m. And so we will be following the same standard, but we will be pausing our regular agenda setting and moving to the public hearing for those members of the public. Okay, moving on to item 5B, joint request for proposals for designated service provider services.
Thank you, Madam Chair. You also reviewed this item, and this is related to an item that you approved maybe a couple months ago on approving a new local agreement with the cities of Olympia, Lacey, and Tumwater to jointly look for a request for proposals to secure the services of PEG, is the Public Education and Government activities. This is the next step in the process, and for the board to authorize issuance jointly the request for proposals with the cities of Olympia, Lacey, and Tumwater. Yesterday, I had a conversation with the city managers, and they have already approved issuance of the request for proposals. So this is the opportunity for the board to do the same.
Questions, Commissioner Edwards?
No questions. Thank you.
Commissioner Menzer?
No, this, of course,
Community Planning and Economic Development, item 6A, request for proposals permitting fee cost and comparison study.
Yeah, thank you, Madam Chair. And this is something that you briefly touched base yesterday during the budget process, and this is related for you to authorize the issuance of request for proposals to secure the services of a consultant to go through and assess the fee costs associated with the permitting process. It is a joint effort between the three departments of community, CPED, the Community Planning, Economic Development, Public Works, and Public Health, mainly environmental health. those two departments play a key role in processing the permits for any particular applicant. It is timely for assess the fees that we currently have. I believe when you review this item, you ask the question whether it's going to be somewhat of a benchmark assessment of other counties. Yes, indeed, it's going to be a benchmark associated with other counties, and I believe that is important to have that benchmark assessment because other counties is no full fee recovery as the Thurston County is. Some other counties may have provided some subsidies related to the fees associated with the permits. So within this context, we expect that this particular effort will cost between $150,000 to $200,000. This is already included on the budget. We are not asking the board to provide any budgetary amounts. And the way we're going to be covering those costs is already in the budget for community plan and economic development to provide funding, also public health, also as well as public works. And I think Jeremy's here to answer any questions.
Questions?
No drain on the current expense fund.
No, sir.
Commissioner Menzer?
Can you remind me what the context was yesterday where we got into this? I don't remember exactly.
Because what you had was a carryover amount in public health moving into next year.
And that's just their contribution towards
Yes.
this?
Yeah, at this point, public health has being allocated about $80,000 towards this effort. Environmental health mainly.
Okay, thank you. Next item is item 6B, grant agreement from Department of Ecology Stream Flow Restoration Funding.
Thank you, Madam Chair. And this is related to going back to the Hearst decision. And the Hearst decision was a decision by the state Supreme Court. They specifically authorized local jurisdictions to continue permitted development related to wells in the county. Also in the 2019 legislative session, they approved somewhat of a Hearst decision fix, which included some many watersheds across the county. I believe we have 5. To start addressing somewhat of management of the impacts of water availability in the county. This particular item is for us to receive $241,048 to begin to conduct a feasibility study in numerous sites of the Nisqually watershed. And that is what also calls the Wire Act 11. And this is aligned with the Hearst decision fix of the 2019 legislation. I think when you reviewed this item last week, you asked the question if in fact this is as part of the implementation of the plan that was approved by the Department of Ecology. And I believe that is on alignment with that particular plan that was approved by Ecology. I think Brad Murphy is here to answer any questions.
Questions? Commissioner Edwards?
I don't believe I have any questions. I think it's pass-through money coming in.
Questions, Commissioner Menzer?
No, I covered it last week.
Okay.
Back cover.
Sorry, Brad.
No problem. Thank you.
Thank you. Okay, moving on to emergency services, item 7A, Department of Ecology Grant Agreement number CEAFCAP-TCEMMD-00035.
Well, that's a mouthful. Thank you, Madam Chair. The Department of Ecology, this Department of Ecology grant provides funding to support the emergency response to severe flooding along the Chehalis, Black, and Scoopumchuck rivers from January 2022 flood. That includes emergency protective measures, distribution of water testing kits, and removal of flood debris to preserve lives, safety, and minimize impacts to the environment. This particular grant of $67,500 was already anticipated, is included in 2022 budget. And the performance of this contract is from January 1st, 2022 through June 30th, 2023. In this particular instrument, this agreement is to accept the money, the grant from the Department of Ecology. Ben?
Nothing further to add. Commissioners, good morning. And Ben Miller-Todd, Interim Assistant Director for Emergency Services. Do you have any questions?
Thank you. Questions? Commissioner Edwards?
No questions, thank you.
No questions from Commissioner Mensah? Okay, thank you. That will conclude our agenda after we go over standing items. Next, the meeting for September 13th for the Board of Health is canceled. And so next is the review of the Board of County Commissioners draft agenda for a meeting of September 20th, 2022. I will not be present for that meeting, so Commissioner Mensah, you'll be leading this meeting.
And when you review the agenda item, we do have an item that requires 3 members of the board to be present. This is related to the voucher list of August 15, 2022, which includes expenditures from the atrium. If you like, we can move this item for this afternoon. And that includes.
That's the only business item on the agenda.
And that's the only business item. The other ones are consent items. And this particular voucher list of August 15 includes a payment of $341. And that's located on page 39. So there's a couple of things that you may consider. There's a proclamation. I'm sorry, I don't want to take over the, sir, go ahead and walk through the agenda.
I'm good. Whatever is going to be better, if I have to take out a pocket, I will.
Some of the consent items, we can move it to today's agenda, and I can walk you through those items, and also we're moving to the following week. There's no other items.
That's
So
it to me.
if that is the case,
I'm okay with doing it.
you may consider canceling next week's meeting. If we move those items.
I'm fine with
It's
that.
up to you two.
I'm good.
I will not be present.
Okay, great. Yeah, we can, there's, I mean, given.
There's nothing there. Let's not overload staff anymore
Or
than
let's
we have
just
to.
do as much as we can today.
And we'll work with the auditor's office because the proclamation I believe can be moved to the following week, which is September 27th, which that meeting is at 6 o'clock.
Whatever it takes.
Okay. So if you're gonna be moving those items for this afternoon, let me walk you through the items if I may.
Yep.
Okay, so then the proclamation will be moved to the week after.
September 27th.
So- And then, okay, let's start with consent item 3A, the Criminal Justice Treatment Account Panel Substance Use Treatment Provider.
Yeah, thank you, Madam Chair, for your consideration. Under RCW 71248580 sets the requirements for members of the local criminal justice treatment account panel and requires the inclusion of a representatives of a substance use treatment provider appointed by the county legislative authority. In this case, for your consideration is to appoint the Olympic Health and Recovery Services as the substance use treatment provider representative for the Criminal Justice Treatment Account Panel, Cjta. As you may recall, the county receives an allocation from Cjta on a yearly basis, and the allocations of the programs to use the Cjta money needs to be part of the Cjta panel. And the recommendations comes to the Board of County Commissioners for final determination, so it is important for you to consider this appointment.
I have a question.
Go ahead, sir.
Is there a requirement for bidding or anything?
No, this is a representative to the panel.
Oh, okay.
Commissioner Mensah, questions?
Maybe Carrie can talk just a little bit more about this panel and how this group would fit in to the bigger, who all's on there and what, is OHRS replacing someone else or filling a vacancy, or how's this all working?
Sure. Carrie Hennon, Public Health and Social Services. So again, this is with my criminal justice treatment account hat on, not treatment sales tax. So as the county manager said, the county receives an allocation of Cjta funds from the state, the Washington Healthcare Authority. The statute lays out, the statute that creates Cjta says each locality will have a local Cjta panel that develops a plan, and I bring that plan to you every year and you approve that plan. The statute does identify members of the panel, including the sheriff's office, the prosecuting attorney's office, public defense, superior court, and drug court are kind of separately named in the statute to both be on the panel. And it has this language about, and a substance use treatment provider appointed by the county legislative body. So in the past, that role has been filled by drug court's contracted treatment provider, which in the past has been, well, still is Pierce County Alliance. I can't tell you for sure whether PCA, Pierce County Alliance, was ever officially appointed by the county legislative body. It was that way when I inherited this fund source, and it's been that way for a long time. As Pierce County Alliance recently had some staff turnover, our panel said, should they still be on the Cjta panel? And it was actually Sabrina Craig, our drug court program manager, who said, well, if criminal justice treatment account is supposed to be generally about the needs of people involved in the justice system with substance use disorders, we sort of overrepresent drug court on the panel because the statute calls for superior court to be there and drug court to be there, and our treatment provider was drug court's treatment provider. So the other members of the panel said, hey, maybe we should have a substance use treatment provider who works more broadly with people at other points in the justice system. So that group recommended Olympic Health and Recovery to be on the panel. This is definitely a bit of housekeeping because, as I said, I don't know when the last county legislative action to appoint someone to the panel took place, but that was the recommendation from the panel. Does that help?
It helps, but then my follow-up then is, did OHRS, they want to do this, or you reached out and asked them? I mean, there are other treatment providers in the community. I'm just curious,
Sure. So they are willing to do this. They said, how many meetings do we have to go to?
Commissioner Edwards and I are on that board, and so we have to be protective of, the activities in that way as well.
So I think they kind of agreed that it makes sense as a good fit. So I did talk to Joe Avalos about this.
I don't remember this coming up in an OHRS meeting.
I don't remember it coming up either, and are we gonna continue doing business with Pierce County Alliance? Don't we have some financial interaction with them?
They're a treatment provider at the drug
that
court.
we use, right?
Yeah.
Not under the Cjta, is the drug court, I believe, is using Pierce County, right?
Pierce County Alliance.
Pierce County.
I just wonder, is anybody gonna get their nose out of joint here? I guess that's about the best way I can put it.
So drug court does still have a contract for treatment services with Pierce County Alliance. I'm not sure membership on this panel is such a great honor that anyone will get their nose out of joint. But it's something we could follow up with.
Is there any chance of any entity gaining a financial gain because of representation? I guess that's the only thing I'm wondering about. I want to make sure we do it right so we don't get criticized later on. And if that's the case, and if you're not sure, is there a time element here that we're up against that we feel we have to do this, you know, in a timely fashion, or is there time for a little research, a few questions to be asked, that type of thing?
I don't feel this is terribly time sensitive. Again, one could argue we've been, since I can't tell you when the last time the board actually appointed a substance use disorder treatment provider, we may be a couple years overdue on this anyway. So
a week or two.
If you want to take a couple more weeks.
Well, I'd like to know some answers to those issues as far as, is somebody feeling slighted? Is there a financial gain of one group over the other because of the representation? I just want to make sure we get it right for, so no one will get criticized with it, that's all.
Robin, you had your hand up?
Yes, thank you, Commissioner. Carrie, can you tell us if any of the money well, I guess I have a few questions. Approximately how much money is the CJTA award?
It's about $377,000 per year.
Okay, and does any of that go to fund services provided by the Olympic Health and Recovery Services?
Currently, no.
No. All right, so
But currently no versus maybe in the future, yes?
it's
maybe.
possible in the future. So perhaps you could say where the money does go, just on a high level.
Sure. Yeah. So most of the money is spent by drug court, and that's actually per the terms of our agreement with the healthcare authority. There's a couple pots of money within this larger pot, and some of it is really earmarked for drug court. So spent by drug court on a few different things, including treatment services through Pierce County Alliance. So PCA does, some of that money does flow out to PCA. That is the biggest chunk of how our CJTA is spent locally. CJTA locally is also funding a small amount of services, primarily urinalysis through Mental Health and Veterans Court, pretrial services. CJTA is funding parenting classes through Family Education and Support Services. Okay, so then the relationship, when I said no, Olympic Health and Recovery Services is not receiving this funding. We do have an interlocal agreement with the Thurston Mason Behavioral Health Administrative Services Organization. That does not go over to the OHRS side. It flows out to Northwest Resources, yet another substance use disorder treatment provider in our community, to kind of augment a TST-funded housing and rental assistance program for individuals who qualify under CJTA.
Thank you.
A tangled web we weave.
How about one other thing? If we have several treatment groups, how did this one get selected? Maybe over
Northwest Resources.
Yeah, but
Yeah, that's what I asked the same. You said it was the panel themselves that suggested OHRS, Carrie?
I think the panel, because of our close partnership on a number of things with the ASO and OHRS on, a number of issues, particularly kind of in the sphere of serving individuals with criminal justice needs, it came up in that way. I think if the board would like to put it out more broadly, we could table this for a while and do some sort of letter of interest process, explain to community providers, hey, this is what CJTA is. The panel must include this. You get to come to some meetings. and, provide input into this plan. Who's
Do they get free
interested? I
coffee?
think we could take the time to do that if that's the will of the board.
That seems to be a good prudent approach.
I think
based
that
on the
might be
conversation.
better.
Yeah, I mean, even though we didn't come up with this, the fact that two of us are on the board, it might
It could be perceived.
might be a better process to do what you suggested, Carrie.
Okay,
I'm just trying to protect everybody.
And so,
Yeah, I
and
think
since time is not of the essence, since this particular appointment has been
Hanging fire for
hanging
a
for a
while.
while, so that sounds like a very good approach
Thank
to consider.
So we're striking this off the calendar, and, we'll do that.
I think I'm helping you cancel your September 20th meeting
Yeah.
if you
So
were.
at a later date, or at a later date.
Okay.
Okay, I will come back at a later date with
Thank you.
a more comprehensive process.
So next item is B and C from Public Health. And they're both resolutions establishing position 40R01638 in Thurston County Pay and Classification Pay Plan. And also a resolution establishing position 40R01637 in the Thurston County Pay and Classification Pay Plan, which is an accounting assistant and a financial analyst.
Yeah, thank you, Madam Chair. I briefly give you somewhat of a heads up yesterday when we were discussing the foundation of public health and how much money the state is bringing to the county. And also we highlighted the need, the public health and social services need on the fiscal department to really keep up with all the many different funding sources, the amount of money, and keeping up with all the many different requirements and the strings attached this money brings. So you are scheduled to have an overall briefing on foundational public health, I think in the next 2 weeks. That this is somewhat of an urgent matter because public health need assistance to really keep up with the demands of those millions of dollars that is bringing to the county. So item 3B is, as Madam Chair stated, is to create a full-time position, an accounting assistant for. This has a higher ending salary of $6,174 per month. And the item 3C is to create a full-time position, a financial analyst position. And this one has a high end per month of $7,504 per month. There's really no issues with the funding because it's enough funding coming to the county. This is not a general fund. And I will encourage the board to approve those two positions.
I'm good, no question.
The financial help they needed with their financial help. Got it.
I know that created a little bit.
Okay, and then the next item is the approval of the voucher list.
Yeah, as I stated, Madam Chair, there is an item on this voucher list for the week of August 15, 2022, which is a combined amount is $6,387,416.78. On page 39, there is
What page?
Page 39 is a payment related to the atrium for $341.68. And based on the direction of the board, I'll bring this item for this afternoon, so you will have 2 weeks worth of voucher approval list. Or it will be department items.
Okay, so those 3 items, item B and C will be moved to our consent agenda for today. And then item 4A will be moved into the department items for today. So for those members of the public who are viewing, our meeting for September 20th is canceled. Okay, it is 10:39. Let's go ahead and take a break.
Thank you.
I can.
Back from break, it is 11 a.m. And we left off with proclamations and awards. And advisory boards and committees, I'll go ahead and give it to Jamie Caldwell, our clerk of the board.
Good morning, Jamie Caldwell, clerk of the board. Outside of what's already been talked about, I was hoping to get a little bit of guidance since we are canceling the meeting on the 20th. That proclamation, if we move it to the 27th, would bump into the Hispanic Heritage Proclamation that we have scheduled for that day. Voter registration day is on 9/20, which is probably why they had it set for that specific agenda. Did you want that one to be proclaimed today as well, or did you want to do it on the 27th and after the fact, or what's your preference? Yeah, we had that on the September 20th agenda, but since we're canceling it, we have another proclamation on the 27th if we were to move it out past the actual day for voter registration day this year.
But we'd have to check with the auditor, right?
Yeah.
To today, we don't know that they're available.
Yeah, so I guess check in with the auditor and see what her preference is.
Okay.
We'll leave it up to auditor. Chair's prerogative. I don't argue too much.
I'll check in with the auditor if she's.
What did you say?
Did I just hear that?
If they're available today, I can go ahead and move it to today, and then we can just do the 2 today for the Kiwanis, if hopefully we.
They're available.
Okay. Okay, outside of everything that's already been talked about, the only other update that I have is that the Agricultural Advisory Committee has their meeting this week, so I'm hoping to have their appointment recommendation by next week for the application that was received in August for Gary Klein. I didn't include it again because it's been reviewed a couple times. Once I get their recommendation, I'll go ahead and get you guys another copy of it, then for you all to make a decision on it.
Okay.
He's trying for the non-farmer.
Yes.
Okay, any questions, comments on that? Okay, next PIO check-in.
Good morning, Commissioners. Megan Porter, Public Information Supervisor. I just have a quick update this morning. I'm working with TC Media to create a video tour of the atrium for staff. So if staff are asking when they're going to have a chance to see the inside of the atrium, that's going to be coming very soon, hopefully this week. And we'll send something out to staff when it happens. Pending any questions, that's what I have.
Questions, comments? No? County Manager?
Related to the atrium and the moving date, we're gonna have a meeting this week, I believe, with the project manager to have a better understanding where the furniture is at. The furniture is starting to arrive at the building itself, so I think the question is gonna be when the labor is gonna be available from the vendor to start installing the building. So I will keep you posted on that. But also at some point I will maybe bring for your consideration, when the majority of the board approved the ordinance outlining the when the board county commissions will meet, there was a part of that ordinance that included the board meetings will begin to be held on November 1st, 2022. That will be 3,000 Pacific. Considering everything what is going on, that is in the middle of budget, really, budget hearings and then the budget process and everything else. And we need to have somewhat of at least 2 week, I call blackout, not necessarily that you're not conducting business, blackout to move this equipment to the new boardroom at the atrium. So as soon as I have a much better information about the schedule, I will bring this an amendment to that resolution, perhaps for you to consider to begin the board meetings January 1st, 2023. That will give us enough time on the transition. It's just when the board will start holding your meetings on the new location. I'm planning to do that. Then more to come.
Questions? Comments?
Prerogative of the chair.
Okay. Briefing, public hearing decisions pending. There's nothing for that. We have 2 executive sessions. So are there any commissioner items that commissioners would like to discuss before we start executive session?
How much time do we have now?
Well, how long are the executive sessions going to take?
So the first one, I will believe is probably gonna be 20 minutes, and the second is gonna take probably 40 minutes. That is gonna be,
That's what I was
I have
thinking.
at 12 o'clock, so
Yeah, so we better get
so
on.
I
with
think you need to give yourself ample time for the executive.
I don't have anything that's time sensitive. I'm
Me,
not
me,
commissioner.
me. either.
Okay, so with that, we'll go ahead and start our,
But I need the attorneys. Can you,
Josh and Travis are out here, I'll go get them.
is Travis there too? Madam Chair, if you can announce both,
Okay.
executive
Hear ye,
sessions.
hear ye.
Hear you. Okay, so the first executive session that we'll be attending is the per RCW 42.30.110 subsection 1I to discuss with legal counsel representing the agency litigation or potential litigation to which the agency, the governing body, or a member acting in an official capacity is or is likely to become a party when public knowledge regarding the discussion is likely to result in an adverse legal or financial consequence to the agency, the delegate for is cut. This is set to last 20 minutes, and commissioner's action may follow. The second executive session is per RCW 42.30.110 subsection 1I to discuss with legal counsel representing the agency, the litigation or potential litigation to which the agency, the governing body, or a member acting in an official capacity is or is likely to become a party when public knowledge regarding the discussion is likely to result in an adverse legal or financial consequence to the agency. Supreme Living. Commissioner's action may follow. This is set to last 40 minutes. So with that, it is 11:07. We will go ahead and go into executive session. Thank you.
Madam Chair.